because piriformis attaches to the front of the sacrum, across the back of the pelvis, into the femur. It's a lateral rotator of the femur and also an abductor. When you take the hip beyond 70-90 degrees of hip flexion, however, it becomes an internal rotator, but it is still an abductor. Therefore, piriformis is always an abductor. In reference to the agonist-antagonist for the rotator series in the IMU Freely program, we talk about applying the 4-sign MET, sitting in the 4-sign position with the legs ankle crossed over the knee. So the hip is now flexed beyond or above 90, which means piriformis is probably one of the muscles contracting isometrically during that internal rotation of the 4-sign. Because piriformis does so many things, and in that one it's an internal rotator, we could use external rotation as the antagonist movement as long as the femur is above 90. Could use external rotation. But because of all these complexities and because what we know in terms of pelvis biomechanics and joint strength ratios, most individuals usually have a discrepancy between hip and abductor strength, which should be a 1-to-1 ratio. Most people are stronger in abduction. Therefore, we suggest that after performing the 4-sign muscle energy technique, because piriformis is also an abductor, logically we could use antagonist adduction strength work as a follow-on from the 4-sign muscle energy technique. I hope that makes sense.